I want to thank you all for your patience as we get started. Again, if you've just joined, I want to just say good afternoon and welcome to the Older Adult Teleconference hosted by our County Executive, Dr. Calvin Ball. I'm Jackie Scott. I am the Director of the Department of Community Resources and Services, and I will be your moderator for this afternoon's conversation. As you join in, please know that on WebEx, all participants are muted. Also note that this WebEx is being recorded, and I'd like to thank you all who have decided to join us by Facebook Live. We are also streaming there. We're going to take about 90 minutes today to discuss COVID-19 updates, safety tips for older adults as we reopen our senior programs and services. I am pleased to introduce this afternoon a list of panelists that you will see virtually on your screen. All are taking social distancing seriously and participating remotely. Today, you will hear from the following: Dr. Calvin Ball, our County Executive, Dr. Maura Rossman, Health Officer, Howard County Health Department, Jenna Crawley, the Administrator for the Office on Aging and Independence in the Department of Community Resources and Services, Holly Sun, our Budget Administrator, Howard County Budget Office, Kimberly Boyd Washington, Deputy Director for the Department of Finance, Brandy Gantz, the Director of the Department of Technology and Community Services, and Stephanie Adibe, Deputy Director, Department of Community Resources and Services. We will also be addressing questions that were sent to us when you registered, and we will be taking questions from the chat features within the WebEx. If you have other questions for the speakers, please go ahead and type your questions in through Facebook or WebEx. We will try to answer as many questions as possible during our 90 minutes today. If we don't have time to get to your questions today, you can email us at townhall@howardcountymd.gov, and we will make sure that we get you the responses to your questions. Thank you so much for joining us today, and we're now going to get started with our opening remarks from Dr. Calvin Ball, our County Executive. Dr. Ball?
Well, good afternoon, everyone. Thank you for joining us, and thank you so much, Jackie, for that wonderful introduction. As Jackie said, we will be providing updates on the COVID-19 pandemic response in Howard County, including tips and resources to help keep you and your family healthy, the impact on long-term care and assisted living facilities, and our reopening progress. You'll also hear from our panel with details on things like food access, wellness programs, virtual programming, and much more. Throughout this public health crisis, I've found myself thinking about our older adults very frequently. Currently, 21% of Howard County residents are 60 years of age or over. In 25 years, nearly 30% of Howard County residents will be 60 and over. In just 15 years, for the first time in U.S. history, there will be more people in our nation over the age of 65 than children under 18. These numbers demonstrate why we have such a sense of urgency to pursue the World Health Organization and AARP age-friendly designation, and ensuring that our county is well prepared for these changing demographics so that our neighbors of all ages live the very best quality of life possible. These demographics demand that we must be intentional in our planning for the increased number of older adults who will reside in Howard County. In part because we want our community to be one in which people want to grow older. When we create or recreate a healthy, safe community for people in which to grow older, we also want to have healthy, safe community for the next generation to grow and all generations to thrive. This pandemic has disproportionately impacted our older adults. And our team has been working diligently to provide critical resources and support for our older adult residents. Howard County and Maryland have seen significant progress in our COVID-19 data trends over the last month. And while these trends are reassuring, it does not mean that we can let our guard down. There is still an inherent risk of contracting COVID-19, and as a community, we need to continue adjusting to remain healthy and safe. As of this morning, Howard County has confirmed 2,520 cases, and 1,800 are active cases. Our team has collaborated closely with our health department to identify locations to do on-site testing, which has benefited some of our older adults. To date, we've tested nearly 8% of our population on our way to our testing goal of at least 10%. And more testing allows us to track and isolate the virus before there will be a serious outbreak. Right now, there are 7 testing sites in Howard County. As we continue to reopen, which is very important for our economy and well-being, we still have some concerns about the risk of community spread. We know that COVID-19 poses a higher risk of complications and severe illness for our older adult population, but the current guidelines for isolation and distancing are difficult to sustain. We know and we feel that our vulnerable populations, people with critical conditions, and our caregivers are struggling. We recognize the challenges that you're facing, and we are here to support you and walk that journey alongside with you. Since March, we have distributed nearly 12,000 grab-and-go meals to older adults in need. The Maryland Access Point team had more than 4,600 contacts with our community just during the months of April and May. And these were regarding food access, caregiver respite and support, virtual programming, and other services available. We know that communication can be difficult, and we want to make sure that everyone is getting accurate and timely information. Please continue to be careful, follow the updates and information from our team, and be sure to keep checking in on your friends and family. You will hear from many experts today on many resources and services being offered to support you during this time. Today, we're looking forward to hearing from you and sharing some of the knowledge and resources that we can provide at this time to both educate and empower you. News and information is quickly evolving, and we ask everyone to continue to follow the latest news and updates at howardcountymd.gov/coronavirus. Again, that's howardcountymd.gov/coronavirus, through the county's social media channels and our office's weekly Ball Bulletin. You can sign up for emails by texting Ball Bulletin to the number 22-828. Again, text Ball Bulletin to 22-828. You can also email ballbulletin@howardcountymd.gov. Again, the email address is ballbulletin@howardcountymd.gov. Or visit our website at howardcountymd.gov/branches/county-executive/newsletter. Our work is still ongoing to make Howard County an age-friendly community, and we look forward to continuing that work despite the current circumstances. As I've said many times, we are committed to creating a county that's not just best overall, but best for all. Thank you again for joining us today, and please remember that together we will get through this. Jackie?
Thank you, Dr. Ball. As we get into our conversation this afternoon, I just want to remind you, as you hear from all of our expert panelists, that the Department of Community Resources and Services serves as a human service agency for the county. And we have 9 offices in our department, and we span the lifespan of all ages. In addition, we have resources for veterans and military families, those who are most vulnerable, whether or not they're dealing with housing insecurity or homelessness, or find themselves victims and survivors of things like human trafficking. We have those resources. Many of you are probably also familiar with our Office of Consumer Protection. That's there. We also have 2 offices that serve the disability community. So as you hear about what work has been going on within our department and with our partners during COVID, please also don't hesitate to contact us if you have other needs related to children, families, grandchildren, caregiving, many different things. We can be resources to help you. So today we're going to begin by talking about something I know that is on the top of everyone's list, and that is health. I'm going to ask Dr. Moore Rossman to open us up by talking about what's been happening within the area of health and healthcare in the Department of Health in the response to COVID. Dr. Rossman?
Good afternoon. Thank you, Jackie, for that introduction, and thank you all for joining us and allowing the Health Department to participate. An interesting thing to note is that typically I usually say, 60 is the new 40. In the era of COVID, 60 is the new 65. And as someone who has jumped up into the older age category when I don't necessarily see myself as that, it's a reminder that our body, our immune system is aging, and we need to take special care of it, and especially during COVID, sort of admit to ourselves that although I certainly feel like I'm 20, the body may in fact be like 65. So with that, among those things as others, we do find ourselves in a unique and interesting and even scary time over the past several months. We've learned new vocabulary like social distancing and flattening the curve. We've learned how to work and socialize virtually, just like we're doing right now. And we, at least for myself, could never have imagined in over just 5 months, the entire country would shut down, begin to reopen, and more than 120,000 Americans would have lost their lives due to this virus. Today, we find ourselves slowly reopening portions of our community while other parts of the nation are pulling back. And there are still many questions about how we can move forward when the virus remains a challenge. The health department on a daily basis analyzes case numbers, positivity rates, testing, and other metrics to ensure that we are making data-driven and evidence-based decisions so that we can move our county and our residents in the right direction. We continue to encourage everyone to use the non-pharmaceutical interventions that we know will slow the spread and the transmission of the virus, until which time a vaccine is developed or other pharmaceutical or medical interventions. We need to continue social distancing. We need to continue the use of facial coverings, sanitizing our hands frequently, and cleaning off frequently touched surfaces. We know now, after about 6 months, that these interventions do make a huge difference. Studies, as Jackie mentioned, studies have continued to confirm what we thought we knew from the beginning from the other countries who were first affected. Older adults, those over 60, and those with pre-existing conditions like diabetes, hypertension, heart disease, and obesity are at the highest risk for serious illness and death from COVID-19 and are more frequently hospitalized. Even as the response to this pandemic moves on and businesses reopen, it's extremely important for individuals in these groups to remain vigilant and not to relax the precautions you have taken over the past several months. And it's also incumbent around all those around our sphere to take precautions to protect those in that category. Even as restrictions for visitors to assisted living facilities and nursing homes are slowly being relaxed, which is crucial for those residents who have been unable to meet with their loved ones and friends in about 6 months. Widespread testing, universal screening of staff and residents, and wearing facial coverings as well as other interventions are necessary to allow these facilities to slowly and gradually resume visitation. The health department works daily with all 6 nursing homes and all assisted living facilities within the county to educate the facility managers and staff on transmission-based precautions, ensure that the staff and residents are now tested on a weekly basis, and continue to provide guidance from the Maryland Department of Health and the CDC. The county executive mentioned that there are now a number of sites where any resident can be tested, and testing criteria for the virus has been loosened so that anyone now who has been in contact or suspects they may have been into contact, even if they are asymptomatic, is eligible for testing. One of the things we've learned over the past several months that we didn't know about in the beginning was about 20% of the population may be asymptomatic but infected and being able to transmit the virus. And that's why now it's important that asymptomatic persons who may have been in contact with other cases are able to get tested so they can isolate and prevent transmission to others. We are also doubling down on our contact tracing. Contact tracing involves talking to a patient who has tested positive to find others with whom they've been in close contact so that those contacts can quarantine for a number of days in order to prevent further spread and offer them testing. The current challenge is that contacts may be resistant to answering questions or concerned about asking or responding to pretty intimate questions. Or they may have difficulty even remembering where they were 2 weeks ago. I know I have that difficulty in these days, especially when every day sometimes seems like Groundhog Day. We are hearing that people do not know what the health department will do with this information or if it will be shared in some way. I can tell everyone that the information that is shared with the Howard County Health Department and the Maryland Department of Health is not shared beyond the Health Department and the Maryland Department of Health. And the sole purpose is to reach out to folks to get them into isolation or quarantine to prevent further spread. Howard County and the state are slowly continuing the process of allowing businesses that were closed during the stay-at-home order to reopen. And the health department works with businesses so that they are opening in the safest way manner. While restaurants begin to allow limited indoor dining, retail stores open their doors, and indoor facilities like gyms reopen, we continue to encourage everyone to practice those non-pharmaceutical interventions to slow the spread of the virus. And a reminder, just because businesses are open, if you don't think it's safe or you're not comfortable going to these businesses, it's okay to stay back. Everyone bears some personal responsibility to keep the community safe. Wearing a face covering while inside a store or restaurant and keeping social distancing whenever possible not only keeps you safe, but also those you may encounter when out in public. And studies are now bearing this in the results of their studies. It's no longer hypothetical. Our health department staff is working with business owners around the county to ensure that they are following safety and cleanliness guidelines while reopening. This includes limiting customers in stores, ensuring surfaces are constantly being sanitized, and that staff and customers wear a facial covering when required by executive orders.
Dr. Rossman?
Yes.
Dr. Rossman, I just want to, so you're watching our time, I just want to say we've got just a few more seconds, and then we're going to move to a few others, but we're getting some questions in there, so I'm sure we're going to be back to you.
Yes, thank you. Just want to finish up. While we're talking about our somatic health, it's important to recognize the strain on our mental health. And just because we are socially distancing does not mean we are socially isolating. And we have been working with the county and many other resources that we will hear from others on how to support our behavioral health and our mental health during these challenging times. Thank you.
Thank you so much. That was critically important, and I know that we're getting a lot of questions, so we'll definitely be back to you. I want to move over now to ask Jenna Crawley, who serves as the administrator for the Office on Aging and Independence here in the Department of Community Resources and Services, to give you a brief overview of all the work that the office has been doing to serve the community during this time. Jenna?
Thank you, Jackie. Good afternoon. I'm pleased to have the opportunity to share with you the continued work of the Office on Aging and Independence. Given our mission, nearly all services have been critical to provide over these last several months, and much of our work has centered around continuing to serve our community in meaningful, innovative ways. Our team has worked tirelessly to transform programs and services that typically are delivered in person to a virtual platform that ensures access to timely information, assistance, resources, and activities. Maryland Access Point, also known as MAP, is operating Monday through Friday and provides vital information and assistance. Calls into our MAP line have remained steady throughout the pandemic, and of note, the most common inquiries received have been about health, caregiving, and food. Our MAP specialists have counseled caregivers who are grappling with the decision to keep loved ones at home or to place them in a facility, and we've seen inquiries regarding food and nutrition double from April to the present. As the pandemic began to unfold, we recognized food access as a primary need. We've worked closely with community partners, including Community Action Council, Neighbor Ride, and Roving Radish, to ensure access to food across our community. We established a grab-and-go meal distribution when our congregate meal program was shuttered due to the closing of our 50-plus centers at the outset of the pandemic. The grab-and-go is now in its 15th week, has served nearly 250 unduplicated recipients, and as Dr. Ball shared, nearly 12,000 meals. To put this in perspective, during the 3 months prior to COVID, we served half of this amount across 7 congregate meal programs. In addition to our grab and go, we have continued to provide home delivered meals to those who are homebound. We're also in the process of establishing a restaurant initiative where we will partner with local businesses to help infuse the economy, along with providing restaurant meals to individuals 60 and older. And we will also hold our annual farmers market coupon distribution at the end of July. Older adults residing in nursing facilities and assisted living facilities have been hit particularly hard by COVID with visitor restrictions and high risk for infection. Our ombudsman has been instrumental with providing creative solutions for families to remain connected and has conducted virtual visits with residents. The ombudsman continues to advocate for residents' rights, their health, safety, and welfare. As Dr. Rossman mentioned, social isolation and loneliness are often a reality for older adults as social circles, health, and mobility change with age. With COVID, this risk has increased exponentially with stay-at-home orders and the closing of central social hubs such as 50-plus centers, gyms, and other places where people gather. To ensure continued social connectedness, even when we are quarantining, our teams have conducted weekly wellness checks, established a low-tech telephonic outreach program with volunteers, developed interactive and engaging nutrition and wellness webinars, and established a virtual 50-plus center that provides over 68 offerings to include exercise and dance classes, cooking demos, history, consumer protection, and social programs. When compared to exercise class participation prior to COVID, the attendance in our virtual exercise classes represent about 45% of exercise attendance for a similar time period from January to March. 93% of our attendees report that the classes are enabling them to stay fit, and 90% report they are experiencing an improvement in their overall health and well-being. We recognize the value of offering remote programming and are currently building out a model that will be sustainable even when we once again can resume meeting in person. At this time, and due to the high risk of our population, 50-plus centers will remain closed until the state of emergency is lifted. However, in the meantime, we are preparing for the time when we can reopen to include reimagining some of our programs, assessing occupancy rates that allow for social distancing, and establishing protective measures for both staff and participants to ensure health and safety consistent with the CDC guidelines. Throughout this pandemic, the Loan Closet has been available and has provided no contact equipment distributions on Tuesdays and Thursdays by appointment. Beginning July 6th, the Loan Closet will accept equipment donations and returns at its Riverwood location by appointment, as well as drop off at the Alpha Ridge landfill durable medical equipment shed. As Dr. Ball mentioned, we continue to pursue age-friendly Howard County, and our age-friendly Howard County initiative has continued despite the inability to meet in person. More than 100 work group members meet virtually each month. Our age-friendly work groups have utilized this time to review the results of our 2020 community survey that was completed by over 3,300 respondents. And our work groups have also reviewed a report that summarized previous county and community-based strategic and master plans from the last 6 years. The work groups will utilize this data to formulate community-wide recommendations and action steps for the age-friendly action plan. The timeline for completion of the action plan has been extended due to COVID-19. And I'd like to just take a moment to acknowledge our Office on Aging and Independence team for the ingenuity, adaptability, and commitment our team has demonstrated during these challenging, unprecedented times. It has truly taken an exceptional team to serve our great community. And just in closing, I'd like to let you know that our MAP team continues to stand by and is available to provide information and assistance during this unprecedented time. And MAP can be reached at 410-313-1234. Thank you.
Thank you, Jenna. That was very informative, and I agree. You all have done a tremendous job, and your commitment of your team all together to serve this community, and I want to thank you for that. Now I'd like to transition over for us to talk about another big job. Dr. Holly's son, who is the budget administrator for the county, has a brief presentation for us. Dr. Sun?
Hey, good afternoon. Hi, this is Holly Sun, Budget Director. I will start with a big picture on the budget and in particular for the Senior Center, and also then I will invite Mark Stromdale, our colleague at DPW, to give a little more detailed update on this project. So what I want to say is the administration placed a lot of emphasis and a lot of support to this Senior Center project. Despite the fiscal challenges there in County Executive proposed CIP budget, we fully funded what's needed for this project to move forward. In other words, based on the proposed budget, in fiscal 21, the project will have sufficient funding not only to finish the Bain Center, but also to finalize the project design as well as start construction for the East Columbia Senior Center project. And also with that, it is planned that that project is going to get completed in fiscal 22 as originally scheduled. Now, during the budget review at the County Council, as you all are aware of, that there were a lot of debate and also discussion related to the overall CIP budget level. Finally, the joint decision from the County Council was to make a budget amendment, in particular with a total reduction of about $23.4 million from the original executive proposed CIP, primarily quoting the general fiscal outlook shadowed by the COVID-19. So as a result, multiple projects experienced reductions in funding from the original proposed budget, and this unfortunately includes Senior Center or East Columbia Senior Center. As a result, this project on the good side will still be able to finish the Bain Center. However, both the construction and the completion will likely be pushed back by at least 1 year for the East Columbia 50+ Center based on the funding received. I will hand it over to Mark, and he can give a little more details on the project status and project plan.
Hi. Yes, so I'm Mark Stromdahl. I'm Chief of the Bureau of Facilities and the Department of Public Works. So as Holly mentioned, the Bain Center continues. In fact, it's very close to being complete. And I have to say it's quite handsome. It's turning out very nicely. So I think it will be a big enhancement to the program at Bain. And it's due to be completed in the first week of August. So so pretty soon you'll be able to transition to whatever programs would be available during this period of COVID. And yes, as Holly also mentioned, unfortunately the appropriation for the East Columbia 50+ Center was cut, and didn't leave us enough money to actually start the project this year. We are continuing to get permits, so the architect and the project team is continuing to complete the project so that we'll be poised next year, hoping that we get the money that we will need for FY22 to start construction, early in fiscal year FY22, which would be like July or August, let's say, in FY22.
Thank you, Dr. Sun, and thank you, Mark. We really appreciate that update. I'm sure we will have some questions. As we move forward, though, I want to introduce Kimberly Boyd-Washington, who is from our Department of Finance. She's the Deputy Director there, and she's going to give us a brief update on a couple of projects that might be of interest. Kimberly?
Great. Good afternoon. My name is Kimberly Boyd-Washington, and as Jackie said, I serve as the Deputy Director for the Department of Finance. I certainly appreciate this time and opportunity to share our tax credit programs geared toward the county senior population, including our retired military. So I will cover some general information about these programs, but all information is available on our website. The addition of the county service catalog toolbar made accessing this information seamless. You can get to the applications, you can get to the FAQs, whatever information is geared towards these programs, you can find in just 1 or 2 clicks. With these programs, we partner with several groups across the county to include our 50+ centers, our Maryland Access Point counselors, and our Commission on Aging to ensure that all of this information is disseminated. So our first tax credit program, which many of you are probably aware of, is our Aging in Place. Our Aging in Place tax credit program actually is geared towards our senior communities who have lived in the same dwelling for at least the preceding 40 years, a citizen that is a retired military member of the armed forces with 20 years of active service, or is a surviving spouse of a retired military of the armed forces with 20 years service and has not remarried. The credit may be granted up to 5 years as long as the property owner remains in the home, and it is a 20% tax credit on up to a $500,000 assessment property value. We have an income-based credit that is made available through the state, our senior tax credit, and it does have income limits. It requires that the combined household income, net worth is $86,200 or less, and that there are net assets under $500,000. This does not include your primary residence, for which the tax credit is sought, but it does include qualified retirement plans. Applications are due on September 1st annually and applied, therefore, to your county property tax bill based on the eligibility and the and 25% of your county property tax. Another tax credit that I'll talk about that is actually available to any resident, but may be pertinent to you or your families, is the Livable Homes Tax Credit, which was enacted in 2012. It helps seniors and individuals with disabilities make necessary improvements that will allow them to stay in their homes by providing a tax credit for the cost of installation of accessibility features in existing residences. This credit could be up to 100% of the eligibility cost, or up to $2,500 of the eligibility cost. And there's an extensive list of the projects that you can complete and receive this credit for. Again, all of that information is contained on our website. We push all of this information out to our 50+ centers, and then our Maryland Access Point counselors also help us with communicating this information. Finally, I'll just mention about our tax deferral program for elderly and disabled homeowners. This tax program is available, and it will allow qualifying homeowners the option of deferring the portion of county property tax currently due, which is in excess of the county property tax that was paid last year. There are some eligibility requirements for this deferral program. You must be 65 years or older and or permanently disabled and have an income of $75,000 or less and have resided in the current dwelling for at least 5 consecutive years. The requirements from the Department of Finance for determining this eligibility and approving, granting the credit is set forth by the legislation, by law, but we work very hard with our partners and with our citizens to make sure that we're able to get this information back from you in the best form possible. All these applications are downloadable online. If you do not have access, please contact the Department of Finance. We work with our residents daily, getting out this information and making sure that you have access to these programs. I just wanted to give a couple stats on these tax credits because I truly am an accountant and I communicate in numbers, not in words so often. And so in tax year 2019, we extended $1,434,161 with the aging in place tax credit alone. Since its inception in 2017, we have granted over 5,800 aging in place tax credits for a total of a little over $4 million. And so we are working diligently to make sure that we communicate and we get this information out to you so that you are able to take advantage of these credits. Again, I appreciate the time being allowed to me to share our tax credit programs with you and encourage everyone to go out to the website, take advantage of that service catalog, love it, use it. It'll be your best friend. Thank you.
Thank you very much, Kimberly. Lots of great information there and lots of good tips. We really appreciate you being here with us today. So we are entering into our home stretch. Our last 2 presenters are coming up. So if you haven't yet had an opportunity to put your questions in the chat, please do. You can put them in the WebEx chat, or you can go to the Facebook page where this is also being streamed and put your questions in there. And that's the Howard County Department of Community Resources and Services Facebook page. So now I'd like to turn this conversation over to Brandy Gantz, who is our Director of the Department of Technology and Communication Services. I think when I introduced her, I pulled her into the community side of services, but we're all partners in serving our community. So Brandy.
Thank you, Jackie. I'd like to share a couple of projects that we've been working on within the technology department that I believe will help all of our residents. And so first, in December of 2019, we released our service portal. I know Kim referred to the service portal earlier. If you need to go to the service portal, it is services.howardcountymd.gov. And on the page, what we've done is we've broken down all of our services into categories. So we have categories for resident, business, visitor, parent, and 50 plus. Most recently, we just added an assistance tab to help you to find any services that are needed during the COVID-19 crisis that we are currently in. In addition, we also just made some very key changes to our service portal. We removed our blue text and replaced them with black text so that they are more visible, so that everybody is able to see them. We also increased all the titles to make them bold and distinct so that the surrounding items are not as visible and it's clear. The titles are very clear. We created a grid view for everyone to be able to go in and look and see everything in a grid view. And we also increased the size of the fonts so that everything looks larger if you need to be able to see anything in a larger format. One of the things that we're doing with the portal is we pulled all the services into one location so that you're able to go there and you can search. You don't necessarily have to always go to resident or 50 plus or business. You can go to the top and you can search for any services that you're looking for, and it will pull it up and provide that information to you easily and effectively. One of the other things that we are also working on is the website. So we have developed a group of individuals that we are working with in order to update our website. So we are working with a vendor and going through the process of designing that currently, and we will be releasing that later this year. Thank you, Jackie.
Thank you, Brandy. I appreciate it. And so our final presenter, before we get into our questions, has a very important topic to talk to you about and to remind you about. Stephanie Adibe serves as my Deputy Director in the Department of Community Resources and Services, and she is leading our efforts around the census. Stephanie?
Thank you so much, Jackie and Dr. Ball, for this opportunity to share important census information and updates with the audience. As you all may know, the 2020 census is underway, and about 25% of Howard County households have not responded. Completing the census provides more than a simple count of how many people live in our country. Participation ensures that our federal, state, and local governments have a blueprint for supporting systems and industries serving the public good, from healthcare to transportation to education and social services. For every person counted in the census, we get an additional $18,000 allocated to resources and programs for our state and county over the next 10 years. And this funding is critical in supporting the programs and services that Jenna mentioned that are offered through our Office on Aging and Independence and many other programs and resources offered throughout the county. Without an accurate picture of our population, we stand to lose billions in funds that help to keep businesses open, residents employed, children fed during school days, and vulnerable residents access to resources and support programs. For every person listening, my plea is that you complete your census today. And after you complete your census, tell 5 other people to complete their census and tell them to tell 5 more people. This is a call to action. We are calling out to our neighbors in Elkridge, Laurel, Ellicott City, and to each household in any community that has not responded. I cannot stress it enough that this year's census will have an even greater impact as the county and all of its residents look to manage the current COVID-19 pandemic and the recovery. The deadline to complete the census has been extended to October 31st, so there is still time. And completing the census is now easier than ever by mail. You complete it by phone at 844-330-2020 or visit my2020census.gov to complete your census today. Thank you, Jackie.
Thank you, Stephanie. Absolutely critically important and great information to be shared. Now we're going to move into the question and answer period that we have. We wanted to spend the bulk of our time hearing from you. I'm going to ask our panelists just to remind them to make sure you remain on mute so that we don't get any background noise while others are trying to answer questions if you're not speaking, and to also try to be as brief as possible with your answers, because we have been lucky enough to have over 200 people sign up for this teleconference, and it is the first of its kind that we have done here in the county. And so we are anxious to make sure that we get as many questions of Dr. Ball's time here with us and his vision of making sure that we are reaching all of our 50-plus community and making sure that we're responding. So the first question, Dr. Ball, that we've gotten in really piggybacks a little bit on what Dr. Rossman talked about. There was a recent article in the Baltimore Sun at the end of last week regarding nursing home deficiencies, and it noted one of our Ellicott City nursing homes. And so the question was whether or not we could speak specifically to our health department efforts and our community efforts around these facilities and what's actually happening now to keep people safe.
Thank you. Great question. It is critical that, as the governor has noted and as our health department has been working on, that we do ensure that our nursing homes are a priority for the residents and for the employees and anyone who can visit, as the governor has begun to loosen restrictions. So, Dr. Rossman, would you please expand on an answer for that?
Sure. So we know that, unfortunately, residents in nursing homes and other congregate facilities have borne the unfortunate burden of being mostly affected by COVID-19, requiring hospitalization and death. And we believe this is because they are the sickest among us, and also being in a close environment that makes the COVID-19 transmission much easier. Since the health department has been working for months with all of our nursing homes to institute improved transmission-based precautions and testing now universally, both of the staff of the nursing home and the restaurants and the residents, and repeat testing as necessary. This is imperative in order to identify those asymptomatic members, primarily the staff, who don't know that they are positive and and are passing this on to the residents. So over time, we have seen improvement in both the cases among our nursing home and assisted living. There was one period of time when all 6 of our nursing homes were in an outbreak status, meaning at least one staff member or resident tested positive. And if I remember my brief out this morning, only 2 of our nursing homes are now in outbreak status, and they can begin to reopen and allow visitation and less restrictions. So it's because they're the sickest. Now, Ellicott City Rehab, unfortunately, not only are these older individuals, but they're also on dialysis, again, creating them much more vulnerable to COVID complications.
Thank you, Dr. Rossman. Dr. Ball, we now have a couple of questions that have come in regarding our East Columbia 50-plus center building project, noting that for the past 6 years or more, the senior community in Howard County has really steadfastly worked with the administration and the council to try to obtain funding for a critically needed 50-plus center in that community. And the question is, how is the administration actively seeking to restore the lost funding for the construction of the new 50+ center, if possible at all this year?
Great question. I'll start and then I'll turn it over to Dr. Sun and Mark. It was a priority of mine in this proposed budget that I sent down to the County Council to ensure that there was sufficient funding for the East Columbia 50+ Center. As the questions have noted, it has been a priority for many years. The challenge, however, is once a majority of the council, 3 council members, had an amendment that cut nearly $24 million out of my proposed capital budget, there isn't sufficient funding now to move that project forward at the pace that I wanted, and frankly, I think the community needed. There are other projects that are further along that needed that funding. We noted that and made sure that the council knew that before that they made that vote. However, with the start of the fiscal year in just a couple days, it is just not a realistic expectation at this time to move things along with that devastating cut from the majority of the county council. And I'll turn it back over to Dr. Sun and Mark Stromdahl if you want to expand.
Thank you, Dr. Ball. I really don't have too much to add. I think what Dr. Ball, what you said pretty accurately described the situation. It's an extremely challenging situation because with the council approved amendment, the total CIP GEO bond funded project there total about $75.2 million. That was the lowest level in the last 1.5 decades. It speaks to the difficulty, and more than half of that, as you all know, are used to support our highest priority, our school system projects as well. So what's left is very limited, barely enough to keep a lot of projects going on just to maintain the minimum needs there for operating maintenance there for some projects there. So it's very, very difficult try to figure out a way to cut them further in order to move money back to this senior center project on that. So I think it's going to be very difficult. Next year, I'm sure we will work closely with the council again and then try to persuade everybody and have them understand this as a strategic priority of the administration, but also from the community.
Thank you, Dr. Sun. Dr. Ball, we have another question about another big project underway here, and that's the Housing Master Plan. As you know, the seniors are 20% of the Howard County population and growing, and some are income challenged. So the question really is in terms of how do we make sure that they are included, that their concerns as an older adult community are being included in the discussion. Is there a second survey, for example, planned, and that would have their considerations heard, and how will the task force analyze and understand senior issues?
Another great question. So the Housing Opportunities Master Plan will be the first time in more than a decade that the county has looked at these issues. I thought it was quite important for us to bring a diverse group of stakeholders and leaders together to work on these issues because so much has transpired over the last decade in the financial and the housing industry. It is especially important as we're looking at the increased numbers over the next several years of our older adult population, and as the housing needs will change for all ages, that we do have a shared vision. And that shared vision only happens when our older adults have a strong voice. And while the COVID-19 pandemic has made it so that we're going to be doing things a little bit differently than we had anticipated, I do want to hear from folks. And there is always an opportunity during this comment period to make your voice heard and let us know your needs and your experiences. I don't know if we have Kelly Cimino on the line. Kelly, are you on?
She's on. Elevating.
Yes, I'm on.
Oh, perfect. Is there anything else that you can expand on as related to the process or timeline or ways that people can make their voices heard?
Absolutely. So I just want to make sure that people understand we chose a very diverse group of people to be members of the task force. We have several members of the community who are very interested in issues dealing with our older adult population. We also have Jenna Crawley from the Office on Aging and Independence as one of the ex officio members of the task force. We did do the first survey that is currently out. We encourage everyone to visit the housing webpage and take that survey. There is room. The last question is for additional comments. We also are working very closely with the Age Friendly Initiative to make sure that information and statistics and findings from the Age Friendly Initiative are reflected in our housing master plan. So by working with the Office on Aging, working with our task force, we will be having community engagement meetings this summer and fall where the community can participate and give us that feedback. We hope that we will be able to address all their concerns and include them in the master plan.
Thank you, Director Cimino. We really appreciate that feedback. Our next question, Dr. Ball, is now turning a little bit back to the health issue. Looking at the spikes that are taking place in other states and surrounding areas due to things like the protests and other outdoor activities, what do we think in terms of our county? Are we prepared for these spikes? And how is Howard County General prepared to handle any increase in patients? And then lastly, one of the related questions is really about getting testing. Who should get tested in this time?
So one of the things that was important to me as we were moving forward and even considering opening before we opened was to ensure that we had a safe environment. In Howard County, within hours of learning of our first case, our first confirmed case of COVID-19 on March 15th, I issued an executive order and I put Howard County into a state of emergency, including being one of the first in the area to close down our malls, our movie theaters, and many other large gatherings. In order for me to feel comfortable even considering moving forward and having these conversations with Dr. Rossman, our first responders, our health professionals, we wanted to have certain building blocks in place. Building blocks that not only had we heard from the White House and the governor, but building blocks in order for Howard County to move forward in an efficient, effective, innovative way. And so we looked at things like surge capacity. What if the hospital had a surge of cases and people who needed to be in the hospital? Ensuring that we had enough beds, ICU, acute beds. Things like personal protective equipment or PPE. Ensuring that we had a sufficient supply of that. Testing. And many other factors that we took into consideration. From my personal standpoint, I think anyone who even thinks that you may have come into contact with anyone who may have had COVID-19, please get a test. If you were at any rally, inside, outside, or any experience where you may have been in contact with someone who may have COVID-19, it's always better to just get that test. I'm going to turn it over to Dr. Rossman for any other points that we need to consider.
I think Dr. Ball has done a great job. The only thing that I would add is that we all need to look at our personal medical histories and those we interact with. So if there is some medical reason why we may be susceptible, then you should take advantage of getting tested. And if you are visiting someone who may be vulnerable, I would suggest that you might want to get yourself tested so that you can protect them.
Thank you, Dr. Rossman. Our next question is specifically about the loan closet and the services that will be provided and when it will move into fuller operational status.
The loan closet is one of our innovative spectacular county resources, and it's something that, frankly, I hear about from people not just throughout Howard County, but the region. And so I'd like to turn it over to Jenna to talk a little bit more about the logistics and how things are operating now and moving forward.
Sure, thank you. So the Loan Closet actually has provided services throughout the COVID pandemic through contactless pickups of loaning equipment. And as of July 6th, we will be accepting donations at our Riverwood location as well as our Alpha Ridge landfill location. At Riverwood, you will need to call the Loan Closet to make an appointment for drop-offs of equipment. But at Alpha Ridge, you can just drop them in the shed that's available there.
Great. Thank you, Jenna. Another question is we have a very active older adult population here in the county is really around services that will be provided to reopen fitness centers in the 50+ center.
So we're trying to balance the importance of having an active, healthy lifestyle with ensuring that, especially when it comes to indoor areas, we are doing what we can to create a safe and healthy environment, especially for those of our most vulnerable population. So we've been working incredibly hard, and I just want to thank everybody on the panel and turn it over to Raul to start off with our recreation and parks, and then I'm not sure, Raul, who after that, whether it's Mark or Jenna, you might want to include in that conversation.
Thanks, Dr. Ball. Yes, our facilities, our fitness facilities and our gymnasiums will be opening up on July 6th. We are taking precautions and doing, proper cleaning and following the CDC guidelines in regards to bringing people back into the facility. Yes, they'll be open actually for all ages, and especially, the active aging as well. But we are going to take the lead from Jackie Scott's Department of Community Resources and Services, in regards to when she opens up her 50+ centers and when we do in-person activities. So we are definitely watching the guidelines and going through that process. But I did want to mention that the 50+ tennis starts next week due to this, it's a sport that provides social distancing, and we actually have 21 people registered for that. So I think the active aging wants to get out there and start exercising as well.
Thank you, Raul. I would ask maybe, Jenna, would you like to say anything else about some of the other activities that are being sponsored right now and will be planned to be continued during this time despite the closing of the 50+ centers?
Sure. So I would encourage people who are interested in exercise opportunities and wellness opportunities to check out our virtual 50+ center, and you can find that information on our webpage. Under DCRS Office on Aging and Independence, and maybe we can put that link in the chat and certainly provide follow-up for that. And we have over 68 offerings that are available right now. We are looking at establishing a pass that will have over 20 weekly offerings that people can exercise from home with a number of our instructors. Just to speak to our 50+ center closure, we really are awaiting state guidance around when we can reopen. As I shared in my opening remarks, 50+ centers and senior centers were one of the first facilities to be closed due to the high risk for our population. So, in the meantime, what we are doing is really looking at our protocols and programs that we can offer in lieu of being present at the centers.
Thank you, Jenna. So our next question we have is from a participant who writes in to say that my parents have been great at staying home. However, I am worried about isolation. How do I balance these issues? And a part of that is also, we had another person write in with a similar concern that was also thinking about how do they encourage memory stimulating activities and other things that combat social isolation.
So I too am in that sandwich generation where I have daughters who are in high school, and I have been, during this COVID-19 pandemic with my sister, taking care of my parents, and also share concerns about isolation, however, wanting them to be as safe as possible. I'd like to turn it over to Ophelia, if you're on the line, to talk a little bit more about maybe some of the resources that we have available.
Foremost, the best way in order for someone to decrease social isolation is to become engaged. And there are many opportunities that our office offers in order to be engaged. So whether it be participating in some of our virtual 50+ center activities, or whether it be you look for an opportunity to help with the grab and go meals as a volunteer through Neighbor Ride, or maybe even our new initiative, which is a Phone a Senior program, which gives the opportunity for individuals. You can either be a volunteer to be one of the callers, or you can participate yourself and receive a weekly social call so that you can connect with someone on a humanistic level. Just what do you have in common? What are your likes? Just making that human contact with a non-techie way via the phone.
Thank you, Ophelia. That's great advice. So we have another family-related question, Dr. Ball. Our participant is writing in to ask a question about when it will be safe to have family gatherings of more than 10 people. They write in to say, my home is the gathering place for family during the holidays. Should I just scrap this year's holiday gathering, or can I hope to have it, or perhaps I should just plan for Easter 2021?
Again, this is something that we're all struggling with. Just earlier today, I was talking with one of my most life-experienced aunts, and my house was the place for gathering, especially during the holidays, because of everyone wanted to spend time with my daughters and what have you. And it's difficult. It's challenging. I think there are a couple things to balance. One, the current governor's orders on large gatherings. Two, the science around being inside, dealing with vulnerable populations, especially people who you're not usually living with. And then three, making it so that we are nimble. We're seeing around the country that some people some entities who have relaxed too many restrictions too quickly without some of the fundamentals actually had to go back. And I think right now we're in an okay place, and we want to make sure that people stay safe. And so there really, I don't think, is a great answer right now, which is difficult for us all. However, I think things will continue to evolve over time. Dr. Rossman, I don't know if you had something to add to that.
Yeah, so I wish that we all had a crystal ball and could forecast, Thanksgiving, Christmas, Easter, and know what those holidays might look like if we could, resume what our routines are for our families. I think I would suggest right now things are pretty quiet and our data is looking good. And this may be an opportunity to socially distance with extended family members outside, where you can go beyond the 10 people, but socially distance in a safe manner. So if one feels the need to get together, I understand that. So think of safer opportunities like being outside rather than inside, and again, using social distancing and facial coverings as a way to mitigate any risk.
Thank you, Dr. Rossman. Linked to that, Dr. Ball, is a question about the fall. A lot of predictions about a surge in the fall. The question is, are we prepared for that surge? And what actions might be recommended in terms of closures if our COVID numbers reach a certain point? What would be the tipping point for going back inside?
So we evaluate numerous factors, like I indicated, PPE or personal protective equipment, tests or positivity rate, and surge capacity, among other things. Right now, we are in an okay place. We will continue to look at all of those factors: hospitalization, acute and ICU bed usage, and making sure that we do see where we are, where the data are trending. Just for example, there may be sometimes people have seen a spike in cases in a day. That could just mean that the labs all took a certain day to process those cases, which is one of the reasons why recently we've been evaluating on a 7-day rolling average, which helps flatten out if there happens to be a person off one day or they took off early on Friday or what have you. So we're going to evaluate all of those data and continue to stay in touch. Dr. Rossman, our first responders, and our entire team stay in very close contact to continue to evaluate the health and safety of our community, so that if the governor continues to open more, we can consider that. Or if there is an outbreak or a surge, we may need to look at pulling things back. Dr. Rossman, did you have anything else to add?
Yes, the only other thing I would add that I'm hopeful in the fall, the CDC may have a test that will both test for COVID as well as influenza. We all know that the fall is a time when influenza begins to rise. I would just suggest to everybody, get their flu vaccine. We're hoping we have it in August, so get it as early as possible. And then hopefully we'll be able to sort out influenza versus COVID with one streamlined test. And then let's all remain hopeful that a vaccine for COVID comes sooner than later.
Thank you. We'll turn back. We have a couple questions that have come back as a result of our conversation around activities. So earlier on, the writer writes, earlier on, before the pandemic, we were planning to expand pickleball courts. Are we still planning to have those activities in the future? And can we speak to those kinds of offerings in the Department of Recreation and Parks?
So in working with Raul and his team, we had quite aspirational, exciting plans to expand many services in recreation and parks, and we've been evaluating the efficacy of expanding and looking at the funding that we got from the county council, some of which was cut. However, we are still looking at trying to do some good and amazing things with the resources that we have. And Raul, if you can talk a little bit more about that, especially pickleball.
Sure, thanks. Yes, actually, we're in the process of adding pickleball lines on several of our tennis courts out there. So we'll definitely be expanding at those locations. Our pickleball courts are actually open at Appleton Park, and as well as the overlays at Hammond Park as well. Also, we hope to be able to go inside here soon at the Meadowbrook Athletic Complex. We're working on a status on how we're going to be able to, create some programs that we can, have indoors for pickleball in the community as well. Laura Weatherall's on the line too. She's our Bureau Chief of Recreation. She wants to expand on any of those programs. Maybe they can't get her on, but I hope that answers your question.
Let's try the elevator.
Bear with one moment.
You're going to try to bring her up right now.
Yes, our goal is to expand where we can through our park system. We're looking at different acquisition sites that we can expand on. Adding pickleball courts, maybe 6 or 7. We're also looking at our existing Western Regional Park for additional locations there as well.
Okay, so we'll circle back around as we elevate her. We have a couple more questions that might come up that she might be interested in. So I want to turn to a question that we've gotten about food access, Dr. Ball. The writer says that they think it's wonderful that several county agencies have been able to collaborate on home meal distribution for seniors who are registered for food assistance. Can we talk more about our food delivery programs and plans?
Great question. We've been exploring how to expand that and trying to build upon the infrastructure that we had, especially with the food delivery. We, in this unprecedented pandemic, have seen more and more need, particularly around food access, than we have seen in a county. At the same time, when, because of the economic challenges, we've seen a lot of budgetary constraints. Jenna, are you able to talk a little bit more about the food access programs? And before I turn it over, please know that we are continuing to try to expand the services because we know that there are a lot of our neighbors, our friends who are still in need.
Yeah, thank you, Dr. Ball. So the Office on Aging and Independence Grab and Go meal distribution is distributed on Thursdays for pre-registered recipients. In order to access this program, people can call our MAP line at 410-313-1234. And we have a simple nutrition screen, and that's just a requirement as part of our funding that we have to complete. But this program is for anyone who is in need of food for multiple reasons. It can be because you don't want to go to the grocery store. It can be due to the inability to prepare your own meals, or as a caregiver, you're looking to supplement food resources for your loved one. And so it's for individuals who are 60 and older and their spouses. And what it includes is 7 frozen meals along with milk products, bread products, and juice or fruit. So I really encourage people who are interested in this program. We've partnered with Neighbor Ride to deliver to those folks who are either unable to or don't want to come out to pick up those meals. And our Neighbor Ride volunteers have really been critical and essential to helping us reach multiple people in our community. We've also partnered with Roving Radish to provide the refrigeration as well as delivery to some of our senior buildings. And they've been just an incredible partner as well. We are exploring other alternative food resources to include grocery distribution, and as I said earlier, a restaurant initiative where we will be able to provide additional ethnic meal offerings. So more to come on that. What I would suggest is just really to check out our Department of Community Resources and Services Facebook page, because we'll certainly do social media posts as well as our website for additional information as those programs get underway.
Thank you, Jenna. We have a few more minutes, and so we're going to try to squeeze in a couple more questions. Dr. Ball, we have, another question from a person who's writing in with a concern. They are concerned about reopening and senior programming within North Laurel and Gary J. Arthur Centers might face a little bit less safe environment, since those buildings will also be hosting child care programs and children's camps. What plans are being made for things like deep cleaning the facilities so that they can be considered safe for vulnerable seniors?
So these are some of the logistics that we're all working on, ensuring that we have frequent disinfecting, that we do have the personal protective equipment with the people who are working there and in and out, that we do help people to maintain that physical distancing. There are going to be some engineering changes that we have. Mark, can you talk a little bit more about some of the details briefly?
There we go. Now I can be heard. Yes, we're very closely following CDC guidelines as far as, creating barriers where we need to, we're working with all of the heating and cooling systems to maximize filtration and maximize air, flushing air through the system. And then we do have touch point cleaning, throughout the day. And we have a heavy duty disinfecting crew on call if we need them. So we feel we'll be well prepared to handle those risks.
Thank you, Mark. I wanted to ask, I see Laura Weatherall and is also on the line now, and Raul, whether or not you wanted to add anything for that question.
Hi.
I'm going to let Laura go ahead and answer that one.
Okay.
Your time is of the essence. With Gary J. Arthur and North Laurel, we are running camps in there during the day starting July 6th, and we don't want to have anything in there during the day other than camps to keep all the COVID regulations to meet what is needed for camp and with our camp certification. We are looking at opening as Raul said, for the fitness area, the gym, and the pool, but all will be by if you just sign up in advance and for our time frames, and that will allow us to maintain the integrity of the number of people who could be in those spaces safely.
Thank you, Laura. We have time maybe for one more question, Dr. Ball, and I know this has come up a couple of times. I see it also in our chat. Looking at the data and watching the county's health site for virus tracking, zip code 21045 seems to consistently have the highest in the number of cases in Howard. It has the second highest in cases per 10,000. The writer is asking for a check-in with the health department for possible reasons for this and for why 21045 might be prone to having higher numbers.
Great question. So I think, there are probably numerous factors, some including the level of density, some including the amount of testing. There could be many things. However, I would caution anyone who looks at the numbers because those are confirmed cases. Right now, we've tested about 8% of our population. And we are also learning through the CDC and many others that there are a larger percentage than we knew at the very beginning of this pandemic who are asymptomatic. And so I generally think that it's best to assume the people around you could have COVID-19. But I'll turn it over to Dr. Rossman, who has a much deeper understanding of these issues than I.
Yeah, thank you for that question. It's very thought-provoking, and we are trying to dig into all of our data to gain a better understanding of the epidemiology of COVID. So 21045 also happens to be the zip code with the highest number of tests performed. So that could be one indication. The other explanation, in addition to that Dr. Ball provided, is that we know Columbia has a higher percentage of Latinx and Black residents in Howard County compared to other zip codes. And unfortunately, our residents of color are disproportionately represented in the number of cases. So the demographics and racial background of the residents living in 21045 may also be a reason for the higher number of cases. But we are continuing to dig into the data again to provide us with a better explanation of how we can offer more testing or other resources to prevent transmission. The other thing that we've learned, especially during the shutdown, that essential workers were disproportionately affected in our cases. So especially those that were support to nursing homes, the hospital, our restaurants, our supermarkets, and those tend to be residents of lower income compared to those being able to continue working by telework.
Thank you, Dr. Rossman. Well, I know that we did not get to everyone's questions today, but we had a full discussion, and I hope you found this helpful. I'd like to pause now and turn to Dr. Ball for some closing remarks to wrap up our conversation this afternoon.
So I'd like to first of all thank our fantastic panel for not only giving great information, but also being available and helping with important questions. I'd like to thank Jackie for moderating and keeping us moving along, our IT department for ensuring that we could actually make this happen virtually, and a special thanks to our sign language interpreter who has been holding it down and making sure by herself that people could be connected. And finally, I want to thank the over 200 people who participated in this conversation and assure everyone this is not the end of our community conversation. We will continue talking about the issues that matter and working together to ensure that you have the very best quality of life possible today and into tomorrow. Thank you.
Thank you, Dr. Ball. Thank you to our panelists. And thank you for all of you who have joined us this afternoon for this discussion. This concludes our town hall for this evening, but please remember, if we did not get to your questions, please send them to us at townhall@howardcountymd.gov. That's townhall@howardcountymd.gov, and we will try to answer them and get them back to you. Thank you again to everyone, and please stay safe, stay well, and have a good evening.